like Katie said, we're from Physician Coach, and I'll tell you a little bit about myself and then a little bit about my partner and co-founder. So just to give you some background, I was initially a Division I soccer player. That's kind of what got me into sports, athletics, performance, and health. I eventually went to medical school in California. That's where I joined the military and did my residency at Tripler in Hawaii. If anyone's ever been there, it's not a bad place. Once I was there is when I kind of figured out I wanted to go into sports medicine. So started to kind of, take my track that way. And in the military, actually had really great opportunities. A lot of people in the military are getting hurt or injured. They're trying to rehab themselves. And so that kind of led me into that field. And sports medicine was kind of that avenue to where then I started to try to understand the nutrition aspect. So learning how to fuel myself, learning how to optimize my performance. But really it wasn't until I met Dr. Hopkins and was introduced to naturopathic medicine that I started to understand how much nutrition actually heals us and how we can use it as medicine. And so from that point, I've really kind of come back from my, conventional medicine side of using pharmaceuticals, standard of care, to understanding that there's better ways to heal ourselves. And that's what a lot of this talk is going to be. What are those things that are barriers to our weight loss and our muscle strength? And how do we treat them naturally versus going to pharmaceuticals, which are actually causing a lot of problems? All right, and then I'll have Dr. Hopkins step in.
Hi, y'all. I'm Ayla Hopkins. I'm the naturopathic physician and other part of this. I won't be doing much of the talk today. Dr. Falconi is going to take that, but I just wanted to show my face and say hello. So like she said, I am a naturopathic physician. I had a practice for about 8 years, doing mostly vitamin and nutrient injections out in the community. So although you can't make an appointment with me at the clinic, I am out in the community giving vitamin injections, nutrient shots. This is something that I have found extremely profound in a lot of people's health. They're not absorbing things. As you'll see in this presentation, some of these vitamins and nutrients are so important to the proper functioning of our cells, of our healing, of our metabolism, and a lot of us are really low. So that's kind of, I take the portion of the business out into the community. Dr. Falconi's in Hilltop at our clinic, and we work together on a lot of our cases. So.
Cool. All right, so this is just a little introduction to where we're at. We're over in Hilltop. This is the outside of our building here. We opened in August 2023, so a little bit past a year now. And we have Red Elm, Ice Cream Social, and then Three Hearts just moved in. So the community is starting to grow, which we're really excited about. One thing that is really important to us is we are not your standard doctor's office. So you'll take a peek inside, and a lot of this is, we have our kind of reception area, but back in the back is a fully outfitted, basically functional fitness gym. This was actually something that was modeled from the Special Forces and the Ranger group. This is how they do fitness and performance. And so starting to combine medical, nutrition, behavioral health into the gym and like integrating everything together. This is a little bit about our team. We're pretty small, but we're growing. Coach Wyatt back there, he was our first hire. He's actually our chief operations officer, so kind of keeps the business running. You don't want doctors running a business, not a good idea. He also is leading a lot of our functional fitness. So since he started, he's gotten his level 1, level 2 USA weightlifting, and will soon be starting his High Rocks certification. Coach Chassie here, so she came on initially, was going to be our head coach, but ended up moving to Alaska for love, so we couldn't stop her. But she is still doing a lot of our programming, especially for some of our clients. So I see a lot of people with injuries, getting them back to health, and then they start working out again, and they're trying to find a safe place. She had a really great background of working at a chiro and a PT clinic, and was also a pretty experienced coach. So she's able to integrate a lot of the rehab stuff into her programming for my clients and help them get fitter. And then Dr. Endo, we just hired on. She's our physical therapist. She's all about joining our mission and starting to get her own coaching credentials and starting to believe in that methodology that we believe in, which is combining a physician and a coach, right? And starting to understand that those things come together. All right, so for today, what we're going to talk about is the foundations of functional medicine and what exactly that means, if you haven't heard of that before. I'm going to hit 4 main topics that really start to mess with our ability to lose weight and perform. So gut health, hormones, environmental toxins, and metabolic health. As I touch on each of these, I'm also going to kind of let you guys know how we test for them, or certain things that you can look for to see if potentially you need to get tested. And then lastly, how you treat it, most specifically with nutrition. So that's our goal today, is not necessarily supplements or herbs or pharmaceuticals, but what kind of nutrition changes can you make? All right, so the foundations of functional nutrition. The primary thing is individualized. So conventional medicine was very much like a broad scope, right? If your labs were between this range, you're good. If they're above or below, you're unhealthy, right? But what we're starting to find with all of these advancements, especially in testing, is that everybody is an individual person, and you cannot treat it as like a whole anymore. So everyone's going to react a little bit differently, and I'll give you some examples of kind of different reactions I've seen with people that at face value would look exactly the same, but I have to approach them very differently with nutrition. The second part is education and empowerment. This is a shift that I think has been tough for doctors, right? In the old days, you went to your doctor, they said, do this, you said, okay, right? That was it. There was no questions asked. Now we have Google, we have ChatGPT. I love the questions I'm getting from my patients. They're very informed. We have people like Huberman and Peter Attia out there spreading a lot of information. And so that is actually helping, one, me be a better provider, but also the patient is more bought in and like willing to make that change because they're starting to understand why we're doing these things. Okay, so starting to take a root cause approach. We'll dive deep into this, but the biggest thing here is everything is interconnected, but we're trying to peel back the layers and figure out what is the primary source of the problem. By the time people get to me, sometimes they have an issue in everything: environmental, gut health, hormone, and metabolic health. And it's trying to figure out how we start to heal these things slowly. Unfortunately, it's no longer I can give you one thing and you're going to get better. That's just not the reality anymore. We're starting to be a very sick society. Okay, and then lifestyle integration. So exercise, sleep, stress management. Most people here are doing a lot of those things well, maybe minus stress. And then macros, and especially micro optimization. Everybody knows, is getting really, really familiar with macro optimization, but getting into the micros and how those help us. So first we're going to dive into the gut. So the gut is made of trillions of bacteria that influence several things. One of the things that the most common sayings I've heard is you aren't what you eat, you are what you eat and absorb, right? And so we could be having the best diet in the world, but if we're having abnormal gut health where we're not absorbing, we're not digesting, we're having some type of dysbiosis in there, then it doesn't matter that it's the best food in the world because your body's not actually taking it in. All right, so we're going to go over a couple common pathologies that you may start to hear. And the interesting thing for me is all of these were really not a diagnosis I ever learned when I went to DO school. All right, so first one is dysbiosis, which basically means of all those trillion bacteria that are in there, they're supposed to be in a certain balance and a homeostasis. When there's a couple bacteria that overgrow, then we become into a dysbiosis, and that can start to cause problems with our ability to absorb and digest our nutrients. The next one is a really big one that I think is starting to get more and more prominent in especially the American, with the standard American diet. It's something called leaky gut. And that's what this picture represents here, is normally our gut is supposed to be this really, really tight barrier. Nothing is supposed to get through it. It's supposed to protect us from all types of bacteria, viruses, and potential allergens. What happens is this barrier starts to break down, and then food particles or other things make it into our system, and then all of a sudden you're finding that your friends are allergic to 10 different items out of nowhere, right? How is that happening? It's happening because our gut health is so poor that it's starting to break down the barrier, and then people are developing allergies they never had until their 30s or 40s. Okay, and then the last one is maldigestion. And that is really just losing the ability to digest our foods. A lot of those things that are happening are because of starting pharmaceuticals. So a proton pump inhibitor for acid reflux. Okay, we think, okay, we have acid reflux, stop the acid. Okay, our acid is supposed to be there. It's supposed to break down our food. The other common one that I see a lot of people have just no education on is gallbladder removal. Gallbladders are being taken out pretty frequently. That is an organ that is actually necessary for like fat breakdown, and people get it removed and then don't get put on any type of supplementation to actually give them bile, right? That thing that they just took out. All right, common symptoms. The first three are kind of those most common ones people associate, like, oh yeah, I have a gut issue. I'm gassy, I'm bloaty, I'm having reflux, I'm having abdominal pain. The ones that people don't think about are the ones that I put in green. So anxiety and depression. Has anybody ever considered that their anxiety and depression might be related to their gut health? No? Yeah, so our gut is actually supposed to take in our hormones and then excrete them out so that we have a good balance. And so it can actually lead to a lot of things that are mood related. The other big one is anything on the skin, you know, dermatitis, eczema, acne. Like, has anyone seen a dermatologist that put them on an elimination diet to figure out what that was? No, never, right? You're getting on a cortisone, some type of other topical cream, and then you're taking some antibiotics or some oral prednisone, right? And so a lot of these things could be stemming from the gut. Okay, and then the last two, diabetes and weight loss. This is starting to get more and more like well known that our gut health can actually impact our metabolic health and our ability to process food, energy, and lead to things like insulin resistance, fat deposition, and obesity. And all of those things become an issue. All right, so what kind of testing do we have? Has anyone ever like gone to the doctor and had some stool testing done? Yep, so it's pretty not a naturopath? Okay, so on the conventional side, it's very minimal what we would look for. We would look for infections, parasites, potentially some viruses or some blood. But now there's, like I said, the invention of more of these tests that are starting to individualize our care are allowing us to see things deeper inside. So one of the big ones is SIBO, which is small intestinal bacterial overgrowth, which we have a small intestine and a large intestine. All our bacteria live in the large intestine. If it gets into the small intestine, then things go really haywire. All of a sudden we have bacteria up where it's not supposed to be and causes some bad issues. Okay, we have a comprehensive stool test, and we've done all these tests to know what our patients go through, but you have to collect your poop and put it in about 5 different vials, okay? But what you get out of that is pretty impressive. And so this is a sample, kind of their sample report. This is not any patient information, but they'll be able to see things like, are you breaking down your proteins and fats? Are you having some type of inflammation in the gut, like leaky gut that we need to treat? Are you having yeast or dysbiosis? So of the bacteria, does it appear to be an abnormal mixture? Okay, and this is only going to get better and better the more people that take this test, because everybody's bacterial composition is a little bit different. Like in America, we're going to have a very different composition than like somebody in India, right? And so they're starting to understand that better, and then we're starting to understand how to treat that better. Metabolic imbalance, like I said. Your metabolic health or your ability to process energy can be stuck in your gut. They've actually done studies where they do fecal transplants, and people who get a fecal transplant from a metabolically healthy person will cure their diabetes or their insulin resistance because they just gained all that healthy bacteria from somebody who was fit. And so it can be stemming from the gut completely, no matter what you eat, how much you exercise, or whatever else you're doing. Okay? And then lastly, infection, which is what we're most familiar with: bacteria, virus, parasites. Okay, and then the elimination diet. This is both a test and a treatment. So, and I put here that it's the gold standard. Really, the best way to kind of figure out what's going on in your gut is to first remove all of the toxins. So we take out a certain amount of foods that we know to be very triggering to people, and then we slowly introduce them back in, and that allows us to see, one, in that time that we eliminate something, usually we get massive gut healing, and so all of a sudden some of your allergens might just disappear, or some of your symptoms might disappear, and then we start to introduce food back, and we figure out what exactly it is that you're having an intolerance to. Okay, and then a food sensitivity testing. These are very popular but wildly inaccurate because of that inflammation in the gut. So if someone comes to you and they have like 20 allergens to food, they actually probably have leaky gut inflammation in the gut, and they're just in a reactive state. So anything they eat is going to trigger them. And those people really need to get like a full clean out of their gut on the elimination diet and let it heal to figure out what the actual allergy is. Okay, so treatment. Starting with maldigestion, what do? We have to get in the things that help us to digest. So has anyone ever taken in bitters? Yep, so this is actually like a common German bitters. In pretty much every other country, bitters are commonly taken with their meals. And in America, we like to put our bitters as decorative, like kale. How many times do you see kale that's like on the outside of a buffet or something to look pretty? Like that's actually a really common bitter that would be better for you and help you digest. Bile salts, like I said, I've seen a lot of people with a gallbladder removed and not on bile salts. So that's just to help them digest those fats. Apple cider vinegar is a really popular one too that helps kind of digest. And then betaine is a common thing that we use to help people who've been on the proton pump inhibitor for a long time, and they have to get that acid back into their stomach to start to process. And then mindfulness eating. We are really, really bad at this, especially doctors. Like we're eating on the run, we're working at lunch, we're eating in the car, right? So you're supposed to sit down. That helps digestion. Also, we'll get into the hormone called cortisol. If you're on the run and eating all the time and your cortisol is through the roof, you're not going to be digesting that food very well, and you're probably going to be in a heightened insulin-resistant state. And so starting to think about, one, being calm, being restful, and then two, chewing your food. We chew less and less now because we're in a rush, and that is part of the process of actually breaking down our food. Okay, for the leaky gut, like I said, elimination diet, which we're gonna go into a little bit more in depth because we're actually gonna offer a virtual elimination diet program starting in February. And then other really common things we use for inflammation are quercetin and turmeric, which are some supplements. Turmeric is actually in curcumin, so you could actually put that into your food. Omega-3s, I know when I did the CrossFit Level 1, they did talk about omega-3 and 6. That ratio is extremely off now because of what we're doing to our animals. And so a lot of times, nearly everybody I'm having to supplement with omega-3s to get them back into that right ratio. And then L-glutamine is another one that's becoming pretty popular. I think both Peter Attia and Huberman have talked about it as something that helps heal the gut. Okay, and then dysbiosis and metabolic imbalance. This is where our pre and our probiotics come in, which a lot of you I'm sure have heard about. So our prebiotics is basically that fuel for the bacteria to break down and be healthy. And then our probiotics are when we're actually taking in things that have that bacteria in them. One of the best things you can do is fermented food. It has the pre and the probiotics in it. And again, it's another thing that's kind of slowly fallen out of our diet. So even just trying to eat a fermented food daily is going to be super helpful. Okay, and then infection. And so I put on here antimicrobial herbal therapy for a reason. Anytime you take an antibiotic, you're basically blowing up your gut, right? You're washing it out completely, and then you're hoping that your body can reestablish its symbiosis with its gut. So when it comes to taking an antibiotic, like it needs to be for a reason, and it needs to be because nothing else is going to work, because you are going to do some damage to your gut that you're going to have to eventually repair, or it will lead to problems down the road. Luckily, that phase of trying to come out of antibiotics has hit conventional medicine, where we're trying not to do that as much, but it's still happening with some doctors out there where they're willy-nilly giving antibiotics for nearly anything. Okay, so getting into the elimination diet. Has anyone ever done an elimination diet or heard about it? Okay, yeah, several people, cool. Okay, so what it's doing is it's trying to take away those triggers. It's trying to heal the gut, remove toxins, using some types of food that actually help with reducing inflammation, and then The most important thing, in my opinion, when doing this, especially for anyone who's doing CrossFit or is an athlete, is that it is not a caloric restriction. Like, that is really, really important. If you do this the right way, your gut will heal, you'll lose a lot of inflammation, you'll probably lose some body weight because of the inflammation, but it should not be used as something to lose weight. Like, that is not the intention in any way. It should be making you healthier and having a better relationship with food. So these are the things that you actually take out. So gluten, corn, soy, beef, and pork, but you can have like more game meat. And then dairy, eggs, and refined sugars. Eggs were by far the hardest thing for me to take out. I don't know about you guys. Eggs was just the hardest thing for me to take out. You don't have to write that down. Okay. And then this was just a super interesting study where they did the elimination diet for people with EOE, which is eosinophilic esophagitis. Basically, the autoimmune system's going crazy in the esophagus. It's swelling, it's closing on them. They're usually having to take oral steroids, potentially EpiPens. Some of them go to the hospital and they have to get it actually opened up manually. So in this study, they did the elimination diet, and what they found was that these people, when they found their triggers and stayed on that trigger-free diet, they had remission for 3 years. This is a really, really hard thing to treat in conventional medicine. And this is a way where functional medicine and naturopathic medicine has come in and said, hey, look, like, not only is this working, but we have studies for you, right? Like, we're proving this. And this was never taught to me in conventional medicine. The other really interesting thing is they did allergy testing with these people, and there was no correlation. So the allergy test would have missed everything they were allergic to, and they wouldn't have known that. Okay, getting into environment. Everybody doing good? Any questions?
I have a question about that. So is the study saying that with eliminating that specific sensitivity, eventually they can consume it again? Or what do you mean by remission?
Remission means it hadn't come back, but it doesn't mean that they put it back in yet, or if that makes sense. So the most common things for those people were milk, wheat, and eggs. So they were keeping them out. Could they get to the point where they could actually eat them again? That's going to be individualized to the person, whether or not it was an allergy that started because of them having esophagitis or the actual trigger of esophagitis, right? And so
You're saying that esophagitis
went into remission. Yep. So then they no longer had symptoms. Okay. So getting into environment. All right. So the way that we like to talk about this is metabolic detoxification. It has that term because detox also kind of implies, alcohol, drug detox, but we're talking about how the body metabolically detoxes. Okay. So one of the things I want to talk about is 85,000 chemicals basically got grandfathered in. And so what that means is that the testing that we should have done on these chemicals did not happen. And so this is why you're going to see all these chemicals that I tell you about, all these things that are natural in our day-to-day that are basically just poisoning us, but we have not been able to make governmental change. Things are slowly happening. Like if you're paying attention at all to California, who's been getting things like red dye 3 banned, right? That's been years and years of a process to remove something that we know is associated with cancer. So this is going to be, like, at least for me, was very eye-opening, was also like very disheartening. And just remember, take baby steps to start to remove these metabolic toxins, okay? But the reason I bring it up for this talk is for something specific in these toxins that are called endocrine disruptors. So what that means is these specific toxins I'm going to bring up to you actually go into our system, and they disrupt cortisol, which is our stress hormone. They disrupt thyroid, which is one of our main movers of our metabolic health. And they disrupt insulin, which is how we process glucose and is the initial problem that happens with diabetes. Okay, so they're actually often referred to as obesogens. So Like I said, you could be doing everything right, but your toxic burden with these obesogens are so high that you're continuing to gain weight, you're becoming insulin resistant, you're having obesity, and so there's so much more to the system than calories in, calories out. Okay, so getting into some of these, and this is a little bit hard to see, so I'll kind of walk you through them. BPA, you know, most people learned about, like you got bottles, they say BPA free. So anything plastic container is gonna have BPA in it pretty much, okay? So those things should be reduced if possible. Even like, you know, the protein shakers, right? They say BPA free, but I just don't trust them anymore. Canned food linings. I don't know if you guys have been on social media where they like get into the Coke can and they remove the metal on the outside and it's a plastic layer on the inside. So canned foods have that plastic layer on the inside that you're getting exposed to. Okay, and then receipts is a big one. All the receipts have BPA on them. Okay, phthalates are our plastic products, but they're also in things like shampoos, lotions, nearly anything with a fragrance, and toys. Like our kids are getting exposed to this worse than anybody else because our kids are basically living on plastic. Okay, PCBs are contaminated fish, meat, and dairy. And so we'll talk a little bit about how you prevent that. Pesticides, everyone is starting to kind of be aware of pesticides now and how many of these organic toxins that they have in them. But the problem is the pesticides aren't just on the produce, right? They're getting into what the animals are eating. So now the animals are ingesting the pesticides. They're leaking down into our water and soil. So now some of our, you know, other vegetables are getting pesticides. So it's just becoming a really big issue. Okay, and then the PFAS, which is that non-stick cookware. Who's already eliminated their non-stick cookware? Yeah, that was a big step for me. Okay, and then things like waterproof clothing, food packaging, carpets, right, degreaser. It's like all of these things that we initially made, I think, to make our lives a little bit easier are actually biting us in the what do you say, biting us in the butt now. Okay, and then artificial sweeteners. So looking at anything you're taking, sucralose and aspartame are probably the two worst. What is Matt Fraser's brand? They have sucralose in it. I love the taste, but I can't have it.
Oh, hard work pays off.
Yeah, not the
Oh, no, it's supplement?
supplement brand. I think it's
I can picture it.
yeah, Podium.
Oh,
Yeah, so they have sucralose in there, unfortunately. Okay, so this is just going to be a little bit of introduction into metabolic detox. It actually happens in the liver. So an introduction of how that happens, the processes, and how we keep them flowing. Okay, so our ability to detox is dependent on four things. One, our exposure. So we can overload the system. So that's why removing exposure is like the first step. Two is genetics, how well our system is processing. Now we're starting to figure out these, what we call epigenetics or SNPs, where we have these small things that are happening in our genetics that can get triggered that then lead to issues down the road. A lot of these SNPs end up dealing with our detox capabilities. The amount of supporting nutrients we eat is a big thing too. And so are we eating, you know, high fiber, cruciferous vegetables, leafy greens, or, you know, are we just focusing on macros? I eat my protein, maybe I have some carbs, everything's coming out of a package because that's easiest, right? And so starting to think about these whole foods and getting them back in our diet because they are helping us. Okay, and then the last one is an elimination. If you're not pooping once a day, that's not right. That's one of the main processes of how we get rid of toxins is through the gut. And so getting that gut health right. The other one is kidneys. And then lastly is sweating, which a lot of you guys are probably doing well in CrossFit. And then that's why saunas are getting so big and showing a lot of benefit is some people are having problems reducing their toxins and increasing that sweat is helping. Okay, so the first thing that happens is oxidation, and again, I'll go into some of these in a later slide. to get out of that phase, when this phase happens, this is actually creating reactive oxygen species that are bad for us. So if we have a problem between phase 1 and phase 2, that becomes a huge issue because we get buildup of reactive oxygen species. The next part is conjugation, and this is where actually a lot of our vitamin shots come in. So methyl vitamins, so your methyl Bs are your B12 and your folate, they become super important because they grab onto things and then help them through the system. Okay, so that's why B vitamins work so well. The other thing is glutathione, if you guys have heard of that, which is a primary antioxidant. It's really hard to get in a supplement form. But again, injection works really well, or eating the right types of foods, but that actually glutathione links to things and pulls it out of the system. A couple of our amino acids, which is why protein is so great to have. It's involved in a lot of different processes in our body. And then sulfuration, so eating sulfur foods actually helps pull stuff out as well. Okay, and then last one is excretion, like I've already talked about. Okay, so how do we know if we're being exposed? So this is actually another test that we just found out about and we're really interested to try. It's called a million marker detox test. The only test that we've seen so far that starts to look into these hormone disrupting chemicals and then what your toxic exposures are. So it'll look into all of those different levels of those crazy names we talked about and tell you how high or low they are and give you recommendations on how to reduce them. I really thought, you know, this image is interesting because 30% of, you know, our ability to detox or what we're being exposed to is what we already have in our body. The 70% is actually from the outside world or changes we can make. And so understanding that, like, it's not just this is who I am, right? It's we have the opportunity to make huge changes in our health and starting to get outside of that mentality that it's just my genetics. Okay, so some of those ways that you can reduce toxins, like I said, this isn't even the most extensive list. This can become overwhelming, so take out one thing at a time. Like a lot of health becomes with first learning how to change habits, right? And so choosing organic or low-fat or no-fat animal food is going to help reduce a lot of the pesticides that you could potentially get exposed to. Use glass, ceramic, stainless steel containers for heating and hot food. Who has kids that you send to school with lunch? What are they getting sent with lunch? What kind of container? Plastic, yeah. My daughter hates me. Her back hurts. Everything's glass. Avoid plastic. So same thing, like water bottles, travel mugs, bladder style hydration, which is tough if you're going on hikes, right? So you're going to be lugging your metal bottle up there now. High fructose corn syrup, which I'm sure most of you have already tried to reduce. Processed foods, starting to look at your labels. All right. Local, seasonal, and organic produce. This is another interesting one where it's like, are you getting things that are seasonal, right? Because if it's not seasonal, then they're making it at an inappropriate time. So it's getting back into that, like what was natural for us back in the day and why are we getting so far away from it, right? So that's a whole nother step into your organic produce is then looking at what is seasonal for the time, and that's what you should be eating. Washing all your fruits and vegetables. Again, even if it's organic, just be safe. And then fragrance-free and solvent-free detergents. There's a lot of great companies out there now that are like really helpful. The hardest time I think we have is with kids, teenagers, right, who want to have those fragrances, but those things also have toxins in them. Okay, removing your shoes. This is an easy one to try to implement into your house. You're tracking in a lot of that or those poor chemicals. Okay, and then filters. If anybody wants to talk to us about air filters, we've done extensive research to our house, and we have a couple air filters we really like. All right, so getting into some of those treatments. In that first phase of liver detox, B vitamins are super crucial. That is like leafy greens, eggs, nuts, and seeds. Is anybody a vegan in here or vegetarian? Okay. And so you need to be especially interested in getting the B12 vitamin, which mainly comes from our meat. Okay, so B vitamins, antioxidants, like I spoke about, vitamin C, E, and glutathione are our main antioxidants. And those are going to be found in citrus, fruits, nuts, seeds, garlic, onions, and broccoli. Some of those things do make people a little bit gassy, but they are really good for you. Flavonoids, which is your berries, your green tea, or your dark chocolate. I recently converted to green tea. It's not so bad if you're a coffee drinker. Try it. And then it's for your health.
Focus on dark chocolate.
Yeah. Okay. Okay, and then iron and magnesium. I highlighted these greens because these are commonly what I see in people's blood markers that are low or suboptimal. So paying special attention to that, or getting your lab work done to make sure you're not low in iron or magnesium. Okay, phase 2, getting those sulfur-containing foods. So broccoli, cauliflower, Brussels sprouts, which are also our cruciferous vegetables. So those, again, those go in there. And these are actually really great for detox. They actually did some studies with estrogen-dominant patients where they put them just on like a cup of broccoli with every meal. And they were able to heal their estrogen abnormality with just broccoli, right? Your methylation nutrients, which is basically your B12 and your folate. And then your magnesium, again, nuts, seeds, leafy greens. You'll find a general consensus that magnesium is just a really important thing to have and be taking. It's why so many supplements have magnesium and people feel good on magnesium. It's because most people are deficient. Okay, and then phase 3 is that excretion. So a couple things that you need to focus on. Fiber. Does anyone know what their fiber recommendation is for a day? 25 for females, up to 35. Yep, good. Does anyone track their fiber like they track their macros? Okay. Those probiotics and those prebiotics that we've already talked about. Hydration. Does anyone know their hydration requirement for the day?
I do, but I'm forgetting.
Yeah.
Half your body weight? Yeah.
0.5 ounces per pound of body weight, right? So if someone is not giving you a recommendation that's individualized to like weight, right, then drinking a liter a day for me and someone else is going to be a much different story, right? So everything should be, when you're really kind of honing in on these things, like weight-based or gender-based, right? Or even age-based as things start to change. And that's when you really get into individualized medicine. Okay, sweating, which you guys are all doing great. And then adequate sleep. We'll talk a little bit more about sleep when we get into the hormones. Okay, any questions on that? So you're just tracking in a lot of potential pollutants from outside, right? Cars are driving, dogs are pooping, right? There's all kinds of stuff. Yep. Yeah.
I have a question about cereals that come in a box. Even if you buy like the good ones, supposed to like Special K and Fiber One and all those, are those, but there's a ton of chemicals probably in those, right? But are those good for you?
So usually what I tell people is the more whole food, the better. A cereal is a processed food, right? They've made it. So if you can get those nutrients, but in a more whole food product, like transitioning to oats, potentially if you're liking that for breakfast. But trying to think about that more than like, what is the good cereal to have? Like if it does not like it came out of the ground, a whole food, like that's the best option. But yes, they're in a plastic bag too. And how are they keeping it well for so long, right? So that all of those things require chemicals. Okay, so getting into hormone balance. When someone asks you, what is hormone balance? Which hormones do you think of? Cortisol. You don't. Who's seen a naturopath? Estrogen. Okay, estrogen, testosterone, right? Yep, those are the main two that you'll hear. But what we actually want to talk about is cortisol. So cortisol is our like master hormone. It can actually go in and influence our sex hormones, our thyroid, our insulin. It can wreak havoc throughout the entire body. And the majority of the population is just now hearing about cortisol, right? I like to bring up this graph here because I use this as like a visual representation of what happens. So Cortisol's here on the left. DHEA, which is basically the balancer of cortisol, is on the right. When we are in a stress state, our body does not know, is it a lion attacking me? Am I stressed because I'm giving a presentation? Am I stressed because I'm in traffic? It doesn't care. It's going to rise your cortisol. When that happens for a prolonged period of time, then it starts to optimize cortisol. Everything is going to cortisol. When you look at the right side of the graph, DHEA is that balancer that starts to go down. But what does DHEA make? Testosterone and estrogen. Okay, so it is very common for someone to be a high cortisol or chronic cortisol person to have low testosterone and estrogen. And it's common for them to come see me with testosterone pellets and estrogen and having absolutely no discussion about cortisol, and they're not sleeping well, they're stressed out, they're not doing anything to manage that, but they're on testosterone pellets. Right? And so again, this is not just happening in conventional medicine, but we're starting to see this with functional and naturopathic medicine as well, where people are just being treated at the bottom instead of finding the root. All right, so this is a topic I actually probably discuss pretty regularly with my patients, is cortisol will cause a functional hypothyroidism. There are a lot of people out there who are coming to me with a thyroid diagnosis and again have never addressed their cortisol or even looked at their cortisol labs. And so, you know, it's something I like to call functional hypothyroidism because to me it is something that can be fixed with cortisol. All right, and so commonly what I see, or I've even heard stories that are pretty sad, where someone was started on a thyroid medication, potentially pretty young. Like I met a couple gymnasts actually who were started on it as teenagers because their thyroid was low, but they're in a very stressed state. What happens is we're putting thyroid into the system, so the body no longer makes it. The body will respond appropriately. It's an insanely intelligent system. So if it sees thyroid in the system that you're ingesting, it's going to stop making thyroid. If you do that for long enough, your thyroid hormone will stop working because it's just turned off. It's the same thing that happens with testosterone for men. If they take it for long enough, their testicles will stop producing testosterone because they don't see a reason to. And that's how they become infertile. So our body is going to respond appropriately to what we do to it. So then they're on the medication for life and there's no way to come off because that thyroid has basically turned off. All right, so one other thing too that is I think people don't realize is it can actually trigger autoimmune diseases. A lot of people believe that autoimmune diseases are purely genetic, but they can be triggered not only by a situation like this with a high cortisol, but also by the gut. The gut can trigger autoimmune diseases. Okay, so this is another one that I commonly see and will have my own personal anecdote about. So cortisol also plays a significant role on the way we balance our glucose. So cortisol is a glucose molecule. It is, again, fight or flight. What do we need for fight or flight? Energy. And so cortisol is going to tell the body to release more glucose into the system. It's going to decrease our ability to respond to insulin. So then you're going to become insulin resistant. And it's also going to push kind of glucose out of the liver, out of the muscle, and then not allow our cells to bring glucose in because it's trying to save us from whatever fight or flight situation is happening. So it is a strong marker or a strong push to people getting into insulin resistance, prediabetes, diabetes. I've seen a couple now, healthy, fit patients. There's no way that they should have metabolic disease, but they're coming in with an elevated fasting glucose, having seen another provider who told them they were pre-diabetic and that they need to do something about it. A lot of them got put on a keto diet and they saw no improvements in their blood sugar, right? Because we're not actually treating the root problem. We're thinking it's a glucose problem. It's a cortisol problem. Cortisol is wondering why it's not getting any glucose, so it's pushing more out, right? With this, performance started to drop and then increased fatigue and glucose levels got worse, right? So this will happen and then these people don't know what to do. Do they just stop eating? Like, why is their glucose not fixing? The funny thing that happened to me is I actually thought I was pre-diabetic because I put on a CGM and my fasting glucose was high every single day throughout the day. And we decided to try a day of fasting. Like, let's see if we can bring it down. my glucose went from like a mildly high 105 to a 130 for the entire day. So I was definitely a cortisol problem that I didn't realize. And my body responded appropriately to like, what are you doing? Like, I made the situation so much worse. And people are going out there and they're doing this. They're thinking they have a metabolic issue. They're going on fasting diets. They're potentially blowing up their cortisol even more, leading to more weight gain and insulin resistance. So it's a vicious cycle. Okay, and then like I said, the cortisol issue will worsen. All right, so just as a kind of recap, so cortisol will come in and it's going to cause insulin resistance, very common thing there. It's going to impact the thyroid function, causing a functional hypothyroid. Again, you're going to increase weight, decrease your metabolic health or your metabolic system. And then it's also catabolic, which means it's a breakdown hormone. So it'll go in there and it will either break down your muscles or tell you to stop building muscle, right? And so that becomes a big issue for anyone trying to lose weight. Our muscle is our powerhouse for losing weight. Okay, and then the last one is it reduces testosterone. Cortisol and insulin basically tag team testosterone when this is an issue, and they drop it into the tank. I bring up testosterone mainly because it's not only important for men, but also for women to have their appropriate amount of testosterone for muscle building and to be in an anabolic state, which is a build-up state. Okay, so how do we test? Like I said, this is very interconnected, so this is where I usually do my comprehensive lab analysis to really figure out what's going wrong. If I just look at cortisol or I just look at thyroid, I might miss the bigger picture. So for everybody, I do a comprehensive panel. There are more intricate testing. The next level up is a salivary test. Has anybody done a salivary cortisol test? Okay, it's basically where you can check your cortisol throughout the day, and then you start to see how that cortisol is changing and when might be the appropriate time to treat it. The last thing, which is the most intensive test, is you get a comprehensive hormone profile, and this is where they check estrogen, progesterone, androgens, along with cortisol, melatonin, and some other organic products there to actually tell where the dysfunction is in the system. Because even just looking at cortisol from the blood, it could be totally fine in the blood, but not getting processed through the gut, right? Or not getting processed through the urine. And so this allows you to get a very, very comprehensive test. For women, they'll actually do 10 different like urine samples throughout their period, because we also have to deal with the fact that our levels aren't just the same every day of the month. Our levels should be different throughout our cycle. Okay, so treatment. Number one is manage the stress. This is probably the most difficult thing to do, right? Because there's some things that we can't remove. You know, having a newborn baby, deciding to get a puppy, opening a business, right? Like stress is stress, and you have to do what you can. Sometimes it's inevitable that it's going to be there, and starting to just treat everything else that you can. Quality sleep. So who gets about 7 to 9 hours every night? Good. Okay, so that is the recommended. Just a couple days of sleep deprivation increases your cortisol, increases your insulin resistance, and causes low thyroid levels. So if you can optimize anything outside of just taking whatever stressful situation out, it's sleep. Sleep will fix nearly everything. Balancing your exercise intensity. This is something that I talk to a lot of people about in CrossFit, especially if they're not on like a yearly training program or thinking about it more than just day to day. If you also have a very stressful life, you can't do high intensity every day, because then you're just on stress, on stress, on stress. Yes, exercise is really, really beneficial to us, but not if everything else around us is on fire, right? A lot of times I'll recommend Zone 2. Zone 2 has so many benefits, but one of the things I tell people is imagine that you're trying to balance that high intensity with some low intensity and some de-stress. You still get to exercise, but you're going to stay in a low intensity, right? Every day doesn't have to be crazy. All right, and then life stressors. So this is a big one that I implement for myself. If I have a particularly stressful day or week, then I will bring down the intensity of my workout. I know that I have to balance in order to not have my cortisol. I have a cortisol issue that led to a glucose issue, so I know that I have to balance it. Okay, optimizing your nutrition. Fueling for performance. I see a lot of people on a hypocaloric diet, which is, one, going to have you not perform as well, but two, it leads to an elevation in cortisol. So when I do nutrition counseling for anybody, it's never been to go hypocaloric to lose weight. It's always about optimizing the nutrition, eating the appropriate way, which we're going to talk about, and reducing body weight that way. Taking in that regular protein. Protein is the only macronutrient that we don't store, right? We store glycogen, glucose is glycogen, we store fat, but we don't store protein. It's only stored in our muscles. Low calorie diet. We don't store protein, so if we don't have a regular source throughout the day, then we're going to take it from our muscles. Okay, and then replenish glycogen. Glucose gets a bad rap out there, but it's very important for performance. It's also important for reducing our cortisol. Cortisol wants a certain amount of glucose in our system, and if it feels that there's a deficit, an inappropriate deficit, it's going to make more glucose anyways, and so you're just battling against yourself. Okay, and then supplementation. Again, magnesium shows up. Omega-3s help a lot with hormonal balance, and then that liver detoxification and gut health. Some of the things that I bring up adaptogens because they are very common. Things like ashwagandha and rhodiola are probably the two most common ones. Has anyone heard of those two supplements? Yeah, so those are coming out more and more in health performance and optimization. They're treating your cortisol, they're just not telling you. Okay, any questions on that? Okay, getting into metabolic health and exercise. All right, so what does it mean to be metabolically healthy? Basically, it's going to come down to energy and how we turn it into food and how we turn it into energy. The biggest two things we're going to look at is glucose and fat. Those are our primary energy sources that when we ingest, that's what their job is, versus protein has many other jobs such as building muscle. Okay, so metabolic dysfunction means that the process in which we take in glucose and we take in fat starts to get disrupted. The first step to this happening is insulin resistance. So what that means is glucose is in our system. When it gets too high, our body releases insulin to bring it into the muscles or the liver. When that process becomes dysregulated, our cells stop responding to insulin. So our body responds by making more insulin to try to shove glucose in. And so insulin will rise to initially balance glucose. Eventually your body will stop responding to insulin and then it'll flip, glucose gets high, and then we have prediabetes, diabetes, and other issues. The next thing that happens with that is something called fatty liver disease. Has anyone heard of fatty liver disease? Yes. It is on the rise because of this problem specifically. Insulin resistance is on the rise and fatty liver disease is on the rise. Unfortunately, people are not testing for insulin resistance, which shows up 10 to 12 years before we ever see diabetes. So again, we're shooting ourselves in the foot and we're saying that we're healthy because we're not actually looking for the disease that's present. Okay, I highlight this in red because this is what we look for. We look for high blood pressure, high cholesterol, heart disease, and diabetes. Like I said, we're 10 to 12 years late if we're already seeing that, right? We could have caught it that much earlier.
How much of that is hereditary?
Insulin resistance?
No, when you start talking about heart disease, diabetes, different things like that in the body, is that something that's a genetic thing?
There are some genetic components, like when we get into heart disease, there's definitely a genetic component to that, as well as some people will have genetic cholesterol issues. They're much more rare than we think. Genetic issues will be very, very high in the early life, just like type 1 diabetes is genetic. A lot of these other ones are not only they're not genetic, but they are reversible. Okay, so the typical testing I do for metabolic health is if you go to your doctor and you can get anything, if you could just request one thing, it's insulin. Get a fasting insulin because that will be your first sign that something is wrong, and that will be abnormal way before your fasting glucose or your A1C. The other unfortunate reality is that a conventional doctor does not consider glucose to be abnormal until it's over 100. However, now that we have programs like Levels, those other companies that are doing CGMs, we now know that an optimal glucose is 75 to 85. If your fasting glucose isn't that, there's something off, right? And that's a tight window. The other thing that I look at is triglycerides. So insulin causes fat deposition or an inability to process fat. That shows up as triglycerides being elevated. A lot of people bring that into a cholesterol issue, but it's actually a metabolic issue. So that should also be run for your metabolic test or your metabolic evaluation. I like to show this graph for people because as you can see, you know, insulin can be high for a long time and it's masking high glucose, right? And so we want to look at insulin and glucose together to see if there's something wrong. All right, and then the continuous glucose monitors are a really great product that's come out. I really appreciate the fact that they've now become over the counter, if you guys don't know that. And I think that the program that they're running is using a lot of data from Levels, which was used for more athletes. So they have some really good data that's targeted to athletes now instead of the general population, which becomes really important when we say what is normal. A normal should not be the general population because unfortunately they are unhealthy, right? We should be looking at athletes. Okay, and then getting into some of the stuff I really love is the metabolic tests and how that lets me know that somebody is having a metabolic issue. So has anyone done a resting metabolic test? No? Okay. No, yeah. You did. You came to us. All right, so the resting one is really easy. You lay down 10 to 15 minutes, you have a mask on, your only job is to not fall asleep. So what does it tell us? It actually tells us at rest how well you're burning carbs and fats, and we're able to tell that through the amount of oxygen and CO2 that you release. With that, we get something called a respiratory exchange ratio, which we have numbers on to tell us, is there something wrong? If it's between 0.75 and 0.85, then that means you are processing your energy well. If it is above that, then that means there's something wrong. If it's below that and you're like a cyclist, that's okay. If it's below it and you're just a general population, then that can also be an issue. And then the other thing I look at is resting lactate. Has anyone had lactate testing yet? Okay, so this is actually an interesting blood test that lets us know our mitochondrial health. So the reason I really like this over blood test is a blood test is just a spot in time, right? It doesn't really tell me how well you're processing actively, right? This breath analysis allows me to see how well your body is doing processing energy, not just a blood test. Okay, so this is just an example of a patient I had where she was actually overweight, has some metabolic disease, but interesting enough, had a normal RER, right? So she wasn't in the bad range to look like she was only processing glucose. But what was interesting with her is she had come into me on a 1,600 calorie diet from her nutrition coach based on her in-body. So her in-body said that that was her resting metabolic rate, 1,500. Her actual resting metabolic rate was 2,600. So she was on an insane calorie deficit that was actually pushing her into hypothyroid when we looked at her labs. The other thing I like to talk about is this is a person that would respond very well to a keto diet because their body likes to process fat. So this also gives you information on someone who may be a good candidate for that or someone who is like, no, this person should definitely be on carbs. Okay, this was another one that was kind of the flip where she had an RER of 0.95 with a lactate of 5. So she was just swimming in glucose at rest. So her body was not processing at all. So she was already kind of in a pre-diabetic state. Okay, and then the active test gives us some other information, especially when we're talking about more performance and how to fuel for performance. Okay, so VO2 max is what most people know about. I like to call it your ceiling of capacity, right? We don't need to touch it much unless you're running into it with your performance. Your fat max and your crossover point are actually related to how well your body processes fat. A fat max for someone that's like a Tour de France person, they want to have a really excellent fat max because they need to do, days and days and days of cycling. A CrossFit athlete doesn't necessarily need to have an optimized fat max because our workouts are very short, right? Crossover point is metabolic flexibility, so how well we can use our fat and our glucose while we're working out. And then the lactate is really where I think we make a lot of actual analysis on performance because, as I'll show you with some examples, our lactate is really what tells us how well we're processing or how well we're building our aerobic base, and then how well my performance is. So here's just 2 different metabolic tests I did. When we look at this, the bottom is time, so how long that they worked out for. And then these colors, this is the steps of their test. So a metabolic test is usually a ramp test where every 3 minutes you'll go up in intensity until you can no longer sustain it. And that's what gives you your VO2. So when I first saw these 2 people, their VO2 max is relatively close, 49 and 46, which is it's pretty good. When I look at the rest of their data, this athlete up here has a crossover point, so they start depending on glucose basically as they're warming up. Okay, so this is a glucose dependent athlete. There's nothing wrong, he's got an excellent VO2 max, but he's a glucose dominant runner. The other thing that I notice is his LT1, which is equivalent to his zone 2 or his aerobic base, is really far away from his crossover point. So this guy has optimized his performance in aerobic endurance. Okay, so if I didn't have lactate, I would think that he's not very fit, right? Because he starts using glucose way too early. But the reality is he's made changes in his physiology and he is very optimized for long endurance races. Okay. The other thing about this client, again, is I would not tell him to work out fasted or to be on a low carb diet because his body wants glucose. It functions on glucose. There is nothing wrong with that because he's optimized with his lactate and he has a really good VO2 max. Okay? The next client, their crossover point happens nearly at their VO2 max. I've never seen this. This person burned fat for their entire test. This person could literally work out fasted whenever they wanted to. It was wild, right? But again, it's like everybody is different. And you have to understand that. And if someone tells you, hey, I have the magic diet plan for you, you're going to lose weight, don't talk to that person. They don't know what they're talking about, okay? Everybody needs to, like, if you really want to hone into this, or if you're having trouble losing weight, like, get an evaluation. There is something wrong. Okay, treatments. A lot of the treatments on metabolic health are actually lifestyle modifications, which is really fun for me. So this is the glucose goddess. She was a really popular person for glucose. But what I really like is she did these tests to prove these concepts. First one is, has anyone ever been told, hey, if you're having trouble with glucose, take a walk after you eat, right? So we're actually using our muscle to pull in glucose. And that is one of the few insulin-independent pathways to control glucose, which means I don't need insulin to control my glucose. I can just walk, right? So that becomes important in people with insulin resistance. And you can see this was without the walk, how high the glucose spiked. And then with the walk, no spike above that mark, right? That's what we're looking for is minimal glucose spikes. The next one is how you separate your meals. So, the old adage of eating 3 to 5 meals a day is actually a really good one. Intermittent fasting, in my opinion, is not a great thing and should be minimally used and for certain particular reasons. So again, when we're talking about cortisol, which can lead to insulin resistance and weight gain, we don't want to intermittent fast leading to a high cortisol state, which then leads to high glucose, right? And so eating those meals throughout the day lets my body know I'm going to get nutrition. I don't have to freak out. Everything's going to be okay, right? That's what we're telling our body when we eat like that. Everything's going to be okay. You're not starving. Prioritizing your carbs in the morning and post-workout. Again, for people who are hesitant to have carbs, there are great times to have it. In the morning is when we're most insulin sensitive, so we're going to handle it the best at that time. And also, post-workout is when our body wants to turn it into glycogen. So that is when I usually have my biggest meal of glucose, is post-workout. Next one is called dress your carbs. So this is another one where you just don't eat your carbs alone. Eat it with some fat, eat it with some protein. It's going to help you control your blood glucose much better. Order of ingestion. So, she kind of did this study, but this was from another bigger study where they had a bunch of people eat a protein, a carb, and a vegetable. And then they changed the order of it. If they ate the carb first, they had a huge glucose spike. But if they ate the vegetable, which was fiber, the protein, which was dressing their carbs, and then the carbs, then it was a slow, steady glucose, right? So just making simple changes like that, of just dressing your carbs and eating them in a certain way, will help you with glucose control. All right, and then
How much time between, let's say I have an apple, do I have 10 minutes to get my nut butter in to dress it, or is it literally needs to be ingested at the same time?
eat the nut butter before. Eat it first, yep. You want to be the first thing that drops into the stomach.
Okay, so it's coat your stomach and
Coat
then
it, yeah.
land in it. Okay.
Yeah, yep. Okay, and then pushing, like I said, those higher carb meals in the morning, lower carb meals at night. Unfortunately, in our society, we love dessert at night. I tell people, if you love dessert, I don't care, have it in the morning. Have it after your workout, just don't have it at night. Okay, and then fiber, like we talked about, fiber not only helps our gut, but actually helps us to control our blood sugar. And then optimizing your micronutrients. This is a source we have on our Instagram, a really great, just quick visualization of which micronutrients you need to optimize your insulin sensitivity, and then what foods you eat for that. I highlight vitamin D and magnesium, because again, these are two that I typically see low on people's labs. Okay, and then getting into exercise. So if we're going to give a recommendation, one, resistance training at least 3 times a week, because muscle is the strongest thing that you can have in there to control your metabolic health. It stores all of our glucose and it uses all of our glucose. And then lastly, it maintains the metabolic rate. So most people who go on a weight loss diet or who go on a GLP medicine like Ozempic, the problem is that their metabolic rate lowers and they're not gaining the muscle that they need to then sustain the metabolic rate, to come off the medication or to come off the diet, right? And so getting these people to understand that muscle is medicine as much as food is medicine. Okay, and then zone 2 or steady state. So 1, it's great for cortisol balance, but 2, it helps with our fat oxidation, right? So we need to be able to burn both fat and glucose. If we always jump into a high intensity workout, we're always going to use glucose because that's what we need. If you learn how to be in a low intensity like zone 2, then you're going to teach your body how to use fat at times and how to use glucose at times. The reason that a lot of CrossFit athletes now are talking about zone 2 is because it's also how you raise the base. If I can raise my intensity that I burn fat at, that means I can use glucose later and I have more glucose later when I need it, right? So that's the concept behind zone 2 training for a lot of more intense athletes. All right, and then HIIT or VO2 max. These workouts are great for stimulating our metabolic rate. Sorry, I'm getting time hacks. Does anyone have to go? Okay, summary. It's like I said, it's not as simple as calories in, calories out, okay? There's so much more to it. 2, it's all connected, and this is probably the most difficult thing I run into when I'm doing comprehensive labs, is where do I start and what was the start of the problem? A lot of the times it takes a couple appointments, a couple different trial of things until we figure out what it is. Medicine is not getting worse, we are getting sicker, okay? It's easy to blame medicine, but the problem is we are a sicker population now. That's why things are not as simple as they used to be. And last one, ogres are like onions, right? We have to peel back the layers. All right, questions?